therefore, our proposal as Council of Governors, let's think of an arrangement where it is possible to have drugs through a funded system to the counties. Do you have banks that are willing to do that? Who will give us a guarantee? Can the national government talk to friendly banks and tell them, as long as money is going to drugs, pay KEMSA for this county, and the exchequer is released, you will be the first charge. If you have an arrangement like that, there will always be drugs in the facility. The doctors and the nurses will always be paid. But as long as we are relying on a system which delays exchequer for 3 months, our medical needs for Kenyans cannot wait for 3 months to be met. We need to be deliberate out there and say we are going to have the ministry having a drive to register chief. I have to go to the village and tell them, today I'm giving you relief food. When they come for relief food, I say register first. I also have to do many other things that maybe can bring people together, and in the process I get them registered. That costs money. You can't go just call them. Our people are very difficult, my friend. Go out there and say I have a meeting tomorrow to register SHA. No one will come. But tell them I have a meeting where I'm giving some goodies from government. They will be there, all of them. Well, goodies cannot be sweet. A ministry understand that. So we need resources, deliberate, to be able to make people come together and register within the shortest time possible. Ne wa Kenya ngi mate andikithĩtie. Ni tuiche Kenya metharwa mari antu resilient ne mere tamuno last minute. Ana ende kura tuona makregister ndakigia mwisho tax ni the same. Indi no ndo ni afya yao ni tamauria ni me register. Na twauga turi counties no tutumire binu cionde. No tutumire gento gitagwa stick and carrot. Tukauga services iria cionde wendaga thiini wa kuma kwa thirikari no tugute muntu mwegania ankiomba kuga agekara ati kuona ati na huduma nere kwa thirikari pero nenkro huduma ya thirikari ile tukwenda with register kwa SHA ugo no kwenda basari register kama SHA ugo no kwenda kunengerwa mbeo ya ng'ombe yaku ni thirikari ya artificial insemination register SHA ugo no kwenda kunengerwa ID card register SHA ugacha kugo no kwenda huduma yothe ya thirikari tunkienda kuwa mbere kucheki kana no register SHA kenda thirikari imenya kuri ori ninkumya kuri andu kinya thiini wa Kenya no mateke bande eni ni malwalaga eni magiyete miaka kugota kibande ya miaka 18 nimo tukumera bubuti buria wakura na kibande bubu ni mwiri waku ni afya yaku koguno anginyo gwata kibande kugota na kyo mbere ndo kibande te yakuthura na gionka na gakuri bagoti kibande gagutethia kuona huduma thini wa cibitari nontu guti kadi ringi ya NHF ni kibande gyaku na system iko only registered.
So far we have done 1.2 million and we're still pushing. Just want to inform you that Kenyans now are starting to register in high numbers. Our figures now go to daily average is about over 60,000 Kenyans are registering daily. We expect this number to go up as we go towards the deadline of 30th September for effective treatment under the Social Health Authority benefit 1st of October. When they gave their ruling, I want to report to you that immediately our council applied for the stay of order, which was granted by the same court, the same judges, that you are given a stay order for 45 days. They had also, in their ruling, they had also given the National Assembly 120 days to reenact these laws. Now, with the stay order 45 days that were granted, that means these acts are still active and therefore we continue implementing them. We have since filed our appeal, the formal appeal, after we are given the 45 days of stay of execution for us to file our appeal. we have submitted our appeal and filed the Court of Appeal. The ruling of that is going to be delivered on our application for stay of order, which you have requested the court to grant us a stay order for the period and when the case will be heard and determined. That ruling will be issued or given on the 20th of September. If the ruling will be that our request be granted, then that means we have time to continue implementing this act and these laws and until the case is heard and determined. If our request will not be granted on the 20th, then that means we'll go back to the 120 days where Parliament had been given time to reenact these laws. So what am I saying here is that we are still within that period, we are still within that time. So we are waiting for the ruling on the 20th. So we are implementing the laws as is. But we take cognizance that if the court gives a negative verdict, we still have 120 days and we shall engage the leadership of Parliament for us to reenact the laws within the period that they had been given, the 120 days. That the end date for NHIF claims and payments will be on the 30th of September. That means anybody who is admitted on the 30th of September and will be in the hospital for that period will be entitled to the NHIF benefit. And therefore, the claims will be paid based on the NHIF rates. Anybody who goes to hospital, treated, discharged, inpatient or outpatient, effective 1st of October, will be treated under the Social Health Authority benefits that we have listed in our earlier presentation. And therefore, when the facility claims for reimbursement from Social Health Authority, they will be claiming based on the Social Health Authority benefit packages. Just to remove any doubt, there will be no staff of NHIF who will lose employment. The government has made all the provisions to ensure that no staff loses employment. We submitted, as in my presentation, we submitted what's called the human resource instruments that were approved by the public service, giving the Social Health Authority the number of staff that they can employ based on their organogram, which they submitted. We have been given an interim approval to start the process, and the process will go on where those staff that had been already earmarked, identified based on the structure, they will be onboarded.
It is the first time that we have a social health authority that is designed to take care even of the non-payroll people. People who ordinarily do not have a salary at the end of the month. So if we achieve this, then we will be able to take care of all these WhatsApp group harabes, which are very irritating to all of us. And we participate to them because our financing strategy as of now is WhatsApp. So what we are saying, can we change from the WhatsApp approach and we come to a formal system, which is actually a social health insurance system, but also government supplement by providing the public sector with everything that is required to provide a service so that purchases are made from there.
CEO has talked about empowerment and contracting of foreign healthcare providers so that services that are available in country then can be provided in a structured way. We will be able to negotiate with the foreign providers of these services and come up with figures that are agreeable. and are in line with the international standards to ensure that we get value for money for our investment.
We will continue monitoring the SHA rollout. We will continue improving the system. We will address the funding gaps and enhance digitization efforts to improve healthcare delivery and data management in Kenya. And again, our collaboration with stakeholders, the governors, among others, is really vital and critical for the success of this. So I call you, even media, please join us so that we can roll this out and we can have Kenyans having affordable, accessible quality of care.
Yes, there is always the fear of fraud. But what we need to keep in mind is we have said everything that SHA will be doing will be digitized. So meaning you will have to have people, in as much as they have not registered, for you to claim through the digital system. Other than you claiming the digital system, we still have the guidelines and on how those emergencies will be handled based on the treatment protocols that have been developed. So it can't be just something that you easily claim and get payment. There must be a process of verification for those claims.
The community health promoter, again, my second point is a very critical person in this process because they will assist through the registration, which is very critical, and especially at the bottom of the pyramid, at mashinani level, where there's the infrastructure probably, even people may not be able to get to the nearest health facility in good time. Therefore, it is important to utilize the community health promoters at the bottom of the pyramid. These are individuals, men and women, who have been able to visit already 7.8 million households. And I want to assure you, ladies and gentlemen, that the Ministry of Health has already done an assessment of all the levels of facilities in this country. The 14,000 health facilities in this country, which includes the public health facilities, the private health facilities, the faith-based health facilities. So we know the gaps, or we knew the gaps even before now. And what we are doing is to ensure that these gaps are fixed in terms of human resources, in terms of infrastructure, and also in terms of equipment that is meant to treat people.